Good afternoon, North Dakota. 74 degrees in Bismarck today, and here we are for another briefing. But thank you all for tuning in, either live or on delayed. Appreciate you taking the time to get information to help guide us through this pandemic. Today, we're releasing the information regarding new tests from the Department of Health. We confirmed 35 additional cases out of 602 tests. That brings today's confirmed positive rate for today, the 35 divided by 602, 5.8% of the tests taken that were completed in the 24-hour period yesterday were positive. Sadly, we must report one additional death from COVID-19 today. This individual was a man in his 40s from Cass County with underlying health conditions. This would be the youngest person so far during this pandemic that has passed away from this deadly disease. And we again recognize that, well, the elderly are at increased risk. Individuals are at a higher risk regardless of age, depending on your underlying conditions. And I guess that's a reminder for everyone that might be under the age of 60 to pay attention to that. Our deepest sympathies and prayers go to this individual's loved ones and to everyone who's lost a loved one to this disease. It's never easy to lose someone, and of course, someone so young. North Dakota has conducted now 15,589 tests with a total of 679 positive. That brings our cumulative rate since the beginning of the pandemic to 4.4%. With that cumulative rate since the beginning, we dropped down to sixth lowest from fifth, but we remain in that spot today. So again, we're behind Hawaii, Alaska, Montana, West Virginia, and Wyoming among those that have the lowest number of positives, which is a good thing. We remain at 9th in the nation for per capita testing rate, which is a good thing, and we're continuing to work to increase our testing rates to help us maintain or move up in that position, because increased testing is key to reopening. Going to the next slide, with today's test results, we're at 436 active confirmed cases, and we've seen 229 individuals recover from this, and again, sadly, moving up to 14 deaths today. Big jump on this slide from yesterday is that we have 6 individuals that were newly hospitalized since yesterday, brings us to 23. That's our biggest single-day jump in hospitalizations, and our second largest ever since the 5 individuals reported back on April 1. As we take a look at the fact that we're at 436 cases, one thing to note on that's more than double the 214 that we had last Wednesday on April 15th, or non-tax day, when we made a decision to hold off on some of the 20% or so of the economy or less that is closed in North Dakota: bars, restaurants, theaters, etc., that are closed, personal care businesses. We made that decision last Wednesday, and we've had our busiest week since then. And so again, we thank everybody for continuing to practice all the North Dakota SMART guidelines. One thing to remember about hospitalizations and them going up today, and the fact that we've doubled the number of cases since a week ago, is to remember that the average number of days so far in North Dakota between onset of symptoms and hospitalization is about 6 days. In some cases, it's been as long as 13 days later, when you might have a maximum increase to hospitalization. So we may expect that our hospitalizations might continue to climb, since we've we're at more than double the number of active cases today than we were a week ago, and hospitalizations trail the identifications of positives. We could see that to go up, but we want to also remind everyone to remain confident that the strong healthcare system we have in North Dakota has plenty of capacity right now to serve patients with hospitalizations, because we've got lots of capacity in hospital beds and in ICUs going forward. On the North Dakota case trends that we're when we look at that, today we're back up in the increase category. The good news is we did have 15 recovered cases, but in combination with the one death and the 35 new cases, that means we had a net increase in 19 active new cases, taking us to that new high number of active cases that we've had. If we take a look at the increased rate of positives on the rolling 14-day average, again, we've noted last week, Thursday, when the White House rolled out gating factors for moving to a phase 1 reopening, and there was 3 phases they described: phase 1, phase 2, and phase 3. But the first phase is one of the gating factors that they would like states to use as a guideline is a downward line in your positive rate of completed tests with the same or increasing number of tests taking. And as you can see on this line, we continue to go up in terms of positive rate of completed tests. So that's the wrong direction that we're moving on this relative to what we would be wanting, the moving direction we're moving for. But again, the math challenge that we'll have, and other states in the perhaps including our neighbors, Montana, Wyoming, and South Dakota, states that have had low percentage of positive rates, and the virus coming here later are likely to see increasing rates of positives as other people are seeing them going down. But a state could meet a criteria of having 2 weeks of declining 14-day averages, and they might be at 15 or 20% positives, and they meet the gating criteria for going down, and we wouldn't, and we would have a half or a third of the number of positives they do. So this is one of the reasons why it's great that states are going to get a chance to make up their own decisions and using the White House direction as guidelines as opposed to a rule, because again, relative to virtually every other state, we're in great shape, and we want to keep our focus on moving forward towards getting our businesses open. And again, a reminder that most of our businesses do remain open. There was a survey done here in Bismarck that indicated that 81% of the businesses here were open. We know that people miss getting a haircut, maybe miss going out to a bar or restaurant, maybe miss seeing someone else that you've seen regularly in a personal care business. But we, again, want to thank those businesses who are going through the mandatory closure period that we're going through right now, because those are the places where we had very high potential for transmissible contact. And people say, hey, I see the big box retailers are open. Hopefully, if you're going there, you can stay more than 6 feet away from everybody else, and you don't have to be within that kind of distance for more than 15 minutes. That's very hard to do in some of the personal care businesses. If you got a half an hour appointment and the person is literally touching you or your hair. So again, under the guidelines, we tried to target those places where we were eliminating transmissible moments. We know that every business is essential. We know every family is essential. We know if you're a small business person, your dreams and hopes in building that business were essential. And that's why we're working so hard to make sure that we can get everything open. But again, all of energy is open, all of agriculture is open, all of healthcare is open, including elective surgeries, and all of education is operating, albeit with distant learning. So again, the majority of our economy never closed, and if you are closed and you aren't under a mandatory order, you're welcome to reopen your business. We say that again, as we take a look at the rolling day average, that's just one factor. But even as we focus on testing and focus on building out our contact tracing, our teams, as you heard yesterday from Michelle Comer, are working hard on guidelines, working with business associations and individual businesses to think about how we can start doing a North Dakota Smart restart. One of the key elements on a step-by-step plan for reopening on the North Dakota Smart Restart, we talked about these. These are the 8 areas we'll keep checking in on. Today we wanted to go a little deeper dive on widespread rapid testing. The reason we focus here is testing is Now, it's not just a guideline from the White House. It really does tell us what our risks are. It tells us the spread of the virus. It tells us, do we have the capability to come in with a rapid response team and isolation orders and actually contain an outbreak after we've opened up? Because again, be clear, when we open up, we will be adding additional risk to our system. We'll be perhaps helping livelihoods, but we want to do that in a way where we're not putting at risk the 20% of North Dakotans who fall into the category of either elderly or having underlying conditions. We want to be very smart about and manage both of those things, lives and livelihoods. And testing is, some people have called it a guidepost. If you were going to use an automotive analogy, testing has been our navigation system that's helped us kind of stay between the two ditches. It is our accelerator that tells us how fast we can open up, and it's got a third purpose which helps us try to look and make projections into the future. In that sense, if we've been driving down a very muddy, slippery road with icy ditches on either side of us that would represent a place you don't want to be. That mud on the windshield has also been a problem. And so the testing and getting a lot more testing done acts as kind of a windshield wiper as well. So it is critical to our forward direction. And our state has not stopped. We've kept moving forward, but we want to get moving even faster, and part of that is really dialing up our testing. As you heard us describe on Monday, we've got a new leader installed, Brigadier General Robert Schulte, who's returned and is taking a lead role there, and he's working closely and for the co-leaders of our unified command, which includes Major General Alan Dorman, who's our Adjutant General and Director of Department of Emergency Services, which the unified command co-led along with Tammy Miller, the North Dakota's Chief Operating Officer, and General Schulte is on the ground, driving hard on testing. General Dorman is here today to give us an update on testing strategy. Thank you, General Dorman, for being here. Thanks for your leadership, and thanks to all of your team in and out of uniform that are doing great work. And again, we gave a shout out to military children, and we know that you're a great leader, but also a great military dad, so a special shout out to your kids too.
Thanks, Governor. And thanks for trying to follow protocol here. Thanks for the shout out to military kids. I have two military kids at home right now getting their education through distance learning. And I tell you, for a seventh grader, it's been a very successful experience. I also have a senior in high school, and that has been more challenging. So if you're watching, Will, get your homework done. I'd also like to shout out, we have Dr. Christy Mason here from our laboratory. I see that it's National Laboratory Professionals Week, and I can tell you I've spent a lot of time at the laboratory in the last few weeks. When the governor talks about literally working 24/7, the laboratory is literally working 24/7. So thanks to our state lab and all those healthcare and laboratory professionals around the state that are working so hard to fight this virus. Here today to talk a little bit about our testing strategy. We use a whole community approach, gathering experts in public health, healthcare, and disease control together to build a strategy to meet the needs in North Dakota. As the governor mentioned, Brigadier General Bob Schulte was brought in on Monday. He is on the ground right now developing situational awareness. I'd like to add, too, that the governor's often mentioned that testing and contact tracing go hand in hand. And Mr. Vern Dosh, who was also brought on Monday, to provide executive leadership and help the contact tracing team. Those two are now best friends, and they're literally going around together because they know how important it is that we link these two efforts together to make sure we provide the best possible testing and contact tracing program to keep our citizens safe. At the forefront of our strategy is increasing our testing capacity. If we increase the denominator, we're able to get a much clearer picture of the situation in North Dakota and make decisions out of fact, not feelings. North Dakota has a strong testing strategy that is focused around testing several core groups, including healthcare workers, residents and staff at long-term care facilities, and other vulnerable populations. We're also focusing testing efforts around large businesses that have seen positive cases of COVID-19, as well as their close contacts, in an effort to mitigate large outbreaks. The results of these focused and strategic testing efforts are guiding our decisions moving forward and are a key component of the ND Smart Restart. We also continue a great partnership with our tribal entities and have conducted successful test collection events at both MHA and Spirit Lake, which resulted in approximately 700 individuals being tested, including 290 at Spirit Lake yesterday. We are also focusing on some long-term care facilities in our other counties across the state in an effort to protect our most vulnerable citizens. As was mentioned at a previous news conference, representatives from the CDC are here working with the North Dakota Department of Health Division of Disease Control to prioritize and outline surveillance test collection strategies and how that will help tell a more complete story in North Dakota. This week, we are heading back to Grand Forks to continue monitoring the spread of COVID-19 due to the positives associated with LM wind power. As far as the types of tests, the state lab is working hard to continue to increase testing capacity. This week, we added 9 new lab technician professionals to help meet our goal of expanding to 18 tests per week 1,800 tests per day. The lab director about jumped out of her seat. 1,800 tests per day. I want to be very clear on that, by April 30th. The lab is also adding an additional 6 pieces of equipment that we hope will bring our test capacity up to 3,000 tests per day by next month. In addition, serology testing, which looks for the presence of antibodies, is going to play an important role in reopening North Dakota. The validation study for a new Abbott antibody assay, SARS-CoV-2 IgG, is pending. We hope to have the new method up and running soon. The Public Health Laboratory has also added a mobile lab to increase capacity. The new equipment is also being installed today and will hold an additional 3 lab workers. In addition to these capabilities, we also have or had 22 Abbott ID Now machines in the state prior to the start of this pandemic, and we received an additional 15 machines from FEMA, and we're able to deploy 13 of those to local laboratories. The advantage of the Abbott ID Now is that it is a rapid test that provides results in 15 minutes or less. Additionally, we're working with other partners, Mayo, Sanford, the VA in Fargo, Elbowwood Memorial Health Center, and Quest Laboratories to help us improve and increase our capacity. Every day, laboratories are bringing new methods online to improve capacity within the state. We will continue to work with healthcare providers to ensure they have adequate supplies to test individuals that are showing symptoms of COVID-19. I'd like to stress that again. We are providing supplies to healthcare entities across the state to ensure that anyone who is symptomatic and wants a COVID-19 test can get a COVID-19 test. Partnering, as I mentioned earlier, in this effort is our contact tracing. We're increasing that capacity every day. As positives increase, contact tracing efforts also must increase. We have a team that is working to ramp up contact tracing efforts, and more information will be provided next week along with an update on our testing. And with that, thank you for your time. Governor, I'll put the mic back.
Thanks, General Dorman. And again, I want to reiterate a couple of those thoughts, not only for our great lab professionals here in North Dakota, Christy and team, but those around the country that have been working overtime the last 6 weeks to help keep our nation safe. It's probably more important than ever. We recognize that as a profession is key to the public health of our nation and the world. And lastly, I also want to put a extra emphasis on what the general said twice, but we talked yesterday about a testing team effort. If we're going to meet our testing goals, if we're going to get reopened up with confidence, then we need to have people who are symptomatic. If you're out there and you're thinking about getting a test, go get a test and help us uncover where COVID is and how we can move forward, and because we're going to have to be living with it for a while as opposed to without it, but you can help us by getting tested, so thank you. Next topic for today is CARE-19. We've talked about this almost every day, and again, we welcome Vern Dosh and his leadership of the contact tracing effort statewide. The CARE-19 application is a valuable tool to help North Dakotans when they use their iPhone or now Android, because the Android is now available. And I want to thank the over 20,000 of you that have already downloaded it, enabled your location services, and to those that are giving feedback to the developer to help us improve the product. Your data remains private. And we encourage you to, again, you can go to the Apple Store, Google Play link, and links can be found under a number of places, including the BeLegendary.link/care19. You can help us save lives with automated contact tracing and help give us the data to help us stop the spread. Smart restart going, and once we're going, help us keep going, because these will be super helpful. Unemployment data for today. Tuesday, the regular claims, 1,150. Pandemic unemployment assistance claims, 169. Pandemic emergency unemployment compensation claims, 232. Again, regular claims now closing in on 60,000. They're at 59,263. That's since March 16th. The pandemic unemployment didn't exist before April 1st, but in that short amount of time, we've had 7,818 claims, and the PEUC claims, also new programs starting on April 4th, 8,400. Next topic, fun one on Parks and Rec. As you may have seen today, we named a new director today for the North Dakota Parks and Recreation. We're excited to welcome Andrea Travnik to the leadership position here. She has been most recently serving as the Deputy Assistant Secretary for Land and Minerals at the Department of Interior in Washington, D.C., and prior to that, she was the Deputy Assistant Secretary for National Parks and Fish and Wildlife. So she brings enormous relevant experience back to North Dakota. Prior to those roles at Department of Interior, she served as a senior policy advisor for natural resources under both Governors Hoeven and Dalrymple. She's a great North Dakota native, and I have to say a NDSU grad and a member of the North Dakota State Athletic Hall of Fame. She had a great soccer career there. But with the weather turning nice, we thought you'd provide an update on our state park system. I want to thank Interim Director Ryan Gardner for his leadership during this time as well. And Andrea will be starting on May 29th. As people know, that we've kept our parks open for hiking and visitation, and so if you've got a nice day, feel free to drive, spend some time by yourself, maintain your distance, go through there. We've also worked in coordination and with the North Dakota Fish and Game, and all boat ramps, that all of our state parks that had boat ramps, those remain open. So we've been able to maintain a lot of opening. Fishing piers, which would normally be going out about this time, we've still got ice, of course, on Sakakawea, and fishing piers remain out until May 15th. That's the earliest date. That could be weather dependent. We have closed the playgrounds at parks based on the CDC guidelines. That's being evaluated and reviewed. We've canceled all reservations and in-person programming, such as ranger programs, through May 21st. And that, again, we get pretty light usage during this early part, typically when school is still in. The real time when things kick off for our state park visitation is around Memorial Day, and we're still hopeful that the state parks could be open by Memorial Day weekend, but we haven't identified when we have identified some trigger points, and again, if we're challenged with continued outbreaks, we may push cancellations out further if decisions are needed. But again, the May 21st is when we're accepting reservations and beyond again right now. The agency is also having further discussions on seasonal staff start dates, because this is a cabinet agency of the state of North Dakota, which manages activities and facilities and lands across the state. It's a big, complex business with hundreds of thousands of visitors that attend over a season, and that group is working on new standard operating procedures for the summer to ensure the health and safety of our visitors and staff, just like every business has to do this, because one of the things that the state park business is in addition to camping, they've also got cabins, yurts, and other great activities, but it's like running a very large statewide hotel system in that way because of all the overnight stays. And so we are working again to make sure we've got smart restart operating procedures for Parks and Rec. So again, thanks to everybody at Parks and Rec that's been working on this. Thanks for keeping the parks open during the pandemic. Thanks for getting all the boat ramps open. And we're looking forward to Andrea here. But again, shout out to everybody at Parks and Rec for your great work. Next topic is behavioral health, which we include every day. And today, maybe we know this is always a serious topic, but we want to add some more seriousness to this, because we know that those who struggle with the disease of addiction face added pressures during times of stress, whether that's financial stress, work stress, family stress, relationship stress, all kinds of stress. The COVID-19 emergency is certainly adding stress to people's lives. And behavioral health is seeing an increased volume of calls and requests for behavioral health support. Local law enforcement agencies continue to report increases in one sad area, which is opioid overdoses and deaths. We know that what can start out as a prescription medication can trigger a deep addiction. Addiction is not a moral choice or failing. It is a brain disease, and it needs to be treated as a chronic, progressive, and ultimately fatal disease. If it's not, it will kill you just like diabetes or a heart disease, which is also a chronic and, if untreated, fatal disease. So we need to drop the shame and stigma around addiction, and we need to treat it like it is a health emergency. And we're in the middle of a health emergency right now, but it's reported last night in Minot that just this year in Minot alone, there have been 6 overdose deaths that have been related to fentanyl, and fentanyl, of course, is a narcotic which can be added to other drugs, highly deadly. So obviously there's a batch of that fatal fentanyl rolling around that community. So again, caution anyone. We have 31 overdose deaths in the state of North Dakota for 2020 that have happened already this year. And so again, if you are struggling with the disease of addiction, you can reach out, behavioralhealth.nd.gov, opioids for resources there, and it also for if you know someone who you think may be addicted to either prescription or non-prescription opioid pain medicine, you'll know to recognize when someone is overdosed, how to identify those at higher risk, such as individuals with a recent period of sobriety, then who are recently discharged from treatment or addiction or incarceration, because the overdose can occur when people begin using again and their body has less tolerance. Also, if you go to the behavioralhealth.nd.gov/opioids, you can request a free 2-dose Narcan kit, which can be administered in an emergency situation. And again, this is a spray up someone's nose and save their life. And if you go to that website, you'll do a little bit of training, and you can have this shipped to you, and we know that having given out a Narcan at Recovery Reinvented events, that lives have been saved in North Dakota by this life-saving first aid tool. If you witness an overdose, call 911, administer naloxone if you have it, follow 911's dispatcher's directions to complete rescue breathing or chest compressions, stay with the individual until assistance arrives, and you can literally save a life. And if you are someone who is also struggling with the disease of addiction and might be with someone who overdoses, I know there's a lot of fear about calling 911 because, hey, I'm using drugs. What's going to happen? Am I going to get arrested? In North Dakota, we have Good Samaritan laws. You'll be protected if you call and save someone's life. So call and save, and perhaps we can get help to you as well. And so again, if you're struggling with addiction, There are many forms of effective treatment, and you're not alone. There are millions of people that are struggling, but we want you to know that there is hope and recovery is possible. Dare to dream about what life would be without an addiction, and visit behavioralhealth.nd.gov for resources, or call again if you want to call completely confidentially and talk to someone who has been through addiction in their life. Recovery Talk, 1-844-44-TALK-2. Visit with a peer support specialist. So again, our condolences go out to those families who've lost an individual to the disease of addiction, and we're with you. And again, thank you as we continue to fight this tragic disease. Next thing, we're flipping into good news, and the good news is that North Dakota Game and Fish, of course, if you're young and you want to, or young or of any age, but if you want to go hunting in North Dakota, you needed to complete an online hunter education course. We had many students who were already enrolled in-person classes. They were canceled. If you're already enrolled, you're going to receive instructions on how to begin taking the course online. So now we're for the first time offering that. If students were not registered and you got extra time on your hands, you can go to GF for Game and Fish, gf.nd.gov, and you can register there. Students will have 2 weeks to complete the online coursework and a virtual field day, and then after completing the course, students will receive a temporary hunter education number, and that number is key because you need to have that number when you submit to lottery applications and purchase hunting license for 2020. We've got some great youth hunting seasons in North Dakota, and if you're of the age, it's great to apply, but to apply, you have to have your hunter education number, and taking this online course will get you a temporary one. Then students have until December 31st, 2020 to take the hunter education written and practical exams, and you can, and if your temporary number does expire, then you have to retake the online course. But I want to say thanks to all of the team members at Game and Fish and to all of our hunter education instructors across state for helping North Dakotans learn how to be safe and responsible while participating in North Dakota's great hunting tradition. And if you love to hunt, it's good to be a North Dakotan, because what an amazing state we have, whatever it is, whether it's wildflower or big game, whatever it is, North Dakota is in a great spot for chasing that and building great family traditions. So thank you, Game and Fish, for finding new and innovative ways, as all agencies are in North Dakota, to continue to do your job and to educate citizens through these unprecedented times. In closing, for our gratitude, today we want to highlight Earth Day. And of course, we know that from the first tribal nations that brought agriculture to this land and carefully stewarded their resources, to the incredible farmers and ranchers of North Dakota today that have made North Dakota an agro powerhouse, to our own Department of Environmental Quality, which safeguards our state's air and water resources. North Dakotans have a long legacy of caring for the land and practicing responsible stewardship of our natural resources. And of course, that goes to our energy industries as well, and the great work they've done over the decades on reclamation and taking care of our land and resources. Today marks the 50th anniversary of Earth Day, and we want to encourage North Dakotans to get outside on this beautiful day, enjoy our incredible outdoors and our bountiful natural resources. When we think about being leaders among states, it's always been wonderful to see North Dakota being one of the top ag states and being one of the top energy states with our all of above energy and energy strategies. And then in addition to that, we're also frequently listed among the leaders in terms of the quality of our clean air and the quality of our water. And so I think that, again, North Dakota demonstrates over and over and over again that this is not about or, it's not about the economy or the environment. It can be and. We can have a great environment and a great economy. And so, again, thanks to everybody that's done their part, whether it's a farmer being a great steward of the land you own, or whether it's any others that are involved in keeping our state clean. There are many ways that you as an individual can make a difference in our state. And again, one of those things during springtime, I know that some of the cities have moved back their spring pickup for when you get to clean out everything in your garage and your basement and your attic and put it out on the curb. Some of that's been delayed till next fall. But certainly, as we do every spring in North Dakota, there's a lot of litter that's been blown around over the course of the winter. And one great way to maintain distance and get some exercise is get involved in any kind of litter pickup work, because that's certainly something you can do that is allows you to keep physical distance, whether it's with a group of people cleaning a ditch or however you're thinking about doing that. But take a moment and let's be grateful for all we have in North Dakota and give a hand by giving back, whether that's participating in picking up litter on your own curb, in your own street, in your own neighborhood, or whether it's doing that in a more organized fashion with some group that's gathering safely, or look for ways to increase your recycling or decrease your waste, or of course another thing which our North Dakota Forestry Department would always encourage, which is this is a good time of year to think about tree planting, and we could always use a few more trees in North Dakota. So as we conclude our gratitude here on Earth Day, again, it's been said that the world has so many beautiful places and so many amazing and spectacular moments of nature, and if anybody's ever watched the screensavers on Apple TV and been dazzled by the things that people get to see that maybe centuries ago they couldn't even imagine, you know that we've got an incredible, beautiful planet, and we've got an amazing state. But what we can all do more here as North Dakotans is to be people who appreciate it even more than we do and enjoy it more than we do. So in a state that's been so blessed with the God-given advantages, rich in soil, rich in minerals, in water, in wind, and in sun. We give thanks today for all that's been given to our state, and we give thanks to the earth that helps nourish us as we work our way through this pandemic, which will pass, and the earth will still be here, and North Dakota will move on with all the great resources that we still have today. So with that, grateful for Earth Day, and we'll move to questions. We're going to go with Dave, then we're going to go online, and we're going to ping pong back and forth today.
I think my question is for General Dorman.
Fantastic. Thank you, Dave.
I corrected him. I said I was going to ask him a question. But this has to do with testing. I think, isn't it tomorrow that you're going to be in Grand Forks?
Yes, we're going back to Grand Forks tomorrow.
What procedures are going to be using, where you're going to be set up and that type of thing?
I don't really want to get into the details. As always, it'll be targeted testing. Some of our strategies have been from the beginning is to do robust contact tracing and then test close contacts and household contacts. And as we gather this information, we can start to see where the links are maybe between cases. And the more information we can get to figure out where the spread is going so we can get out ahead of it, the quicker we can beat back those hot spots like we had in Grand Forks. So the testing will be focused on the close contacts from those positive cases we had last week. It'll be focused on some areas where we think COVID-19 has maybe jumped to other locations, so we want to test there too. And then as always, we will do some surveillance testing, which provides valuable data on what's the percentage of, say, asymptomatic people walking around, because that's valuable information that, again, helps us stop the spread.
I just want to follow up. You mentioned that to have a mobile lab. Is the mobile lab going to go?
Well, we have a mobile lab, but it's not the one I talked about earlier. Because of the increased testing capacity at the North Dakota State Lab, we have brought in one part of a two-part temporary lab facility. So one of those mini laboratories is ready to go right now. We anticipate another one coming in a couple of weeks to match up with that. So as this equipment we're pursuing comes online, we want to make sure we're prepared with the laboratory space and also the laboratory technicians to make sure as soon as the testing capacity gets here, we can get it up and running. Thank you.
I actually have some follow-ups for the Major General. For the testing in Grand Forks tomorrow, any idea how many individuals you'll be testing or meeting with, or what the capacity is?
Tomorrow, right now, we're planning to go up with probably 700 or 800 tests. And again, whenever we do these operations, it's to pursue a statewide strategy. but we're always in support of local public health officials. So we'll be working with the local public nurse there, Deb Swanson. We've been in close coordination with the mayor and the other city leaders in Grand Forks to make sure we're working in partnership to get the right people there to be tested. Both two things. One is to make sure we stop the spread of the COVID, and two, to see what we can learn through surveillance testing to come up with new strategies, or maybe they will validate our existing strategies and we can keep iterating off of those.
And on the new mobile lab, what determines the priority to mobilize it?
Well, the mobile lab is actually stationary. So, it is on wheels. It'll get wheeled in behind the state laboratory. It's set up there. It's already been plumbed. It already has electricity. It is ready to go as soon as the equipment shows up to put it in there. So.
Thank you.
Online?
With WZFG KFYR Radio, will you consider allowing K-12 schools to open beginning May 1 if they choose to?
That's the question from Scott, is we haven't made that determination yet. We know that there are a lot of factors. K-12, we're looking at this. We, of course, I think Lieutenant Governor Brent Sanford and I would love to rescue part of the senior year, particularly for those seniors. We know that some countries like Sweden have re-entered with their youngest students. I mean, where people that are least vulnerable, sort of K through 6, as a way to keep education going in person. But there are a lot of factors here. 110,000 students plus tens of thousands of teachers all getting back in a congregate environment. And when we do that, we know that we've got a lot of teachers that may fall into that category of being, of an age, or may have underlying conditions. Because again, underlying conditions, people can be going to work every day, but might be diabetic and might have some kind of respiratory disease, or may have heart disease. We also know that there's a lot of special needs students around the state that may have compromised immuno issues, any kids that have gone through cancer treatment, something like that. So we have to consider everybody when we're thinking about this reopening. And part of the whole push for reopening, of course, on the economic side, on the bars and restaurants and personal care, has been the economic crisis. There is no economic crisis occurring in education because teachers are getting paid, superintendents are getting paid, students are getting educated, and so it's less urgent from a quote reopening than actually some of the other economic businesses. But obviously we'd like to think about how do we get back to education, but we also have to understand that in the even in the Phase 1 White House guidelines, that the White House was recommending during Phase 1, bars are not open and schools remain closed and keep doing distance learning. So we should take a look at those. I mean, they're published online, but when we talk about a phased opening that's a smart restart, it doesn't mean we go from the things that are all closed, everybody going back and having lots of transmissional moments right on May 1, because that's the thing where we could end up with a bigger spike in May than what we avoided in April. And our goal here is to try to manage this thing through, and not to and not find ourselves in a situation where we don't have the testing capacity or the rapid response teams to handle a large spike. But having said that, we are looking every day about how we can move things forward back to more open instead of more closed. That's the direction that we're driving. But schools for right now, there's a lot of complexity, and B, I actually think there's other priorities from an economic hardship standpoint, because again, there's no economic challenge right now with schools. Okay, we're going here, Tom.
So American Legion, go to the toy department for a minute, canceled baseball Monday night, to the disappointment of many, probably to you too. But we've gotten a lot of calls, a lot of input from people. Jackie Barman is a senior citizen from Williston, and she wants to know if there's any way, as they look to replace baseball with American Legion this year with some other kind of a baseball league, and that's what they're trying to do in Williston. If there's a recommendation from the governor on doing that, she feels that, as many do, that it's a mental health treatment thing as well, because the kids are getting cooped up. They want to get out and play some sports. You love the outdoors, you love the sports. What say you, Governor?
Well, the good news is the governor doesn't right now have any authority over other sports leagues in North Dakota, so that's one thing I don't have to deal with day to day. But I mean, as a kid in high school that loved sports, lived for sports, I have my heart is all these kids that are missing, whether you're senior year of track or senior year of baseball. I know how heartbreaking that is and how hard it must be to be in this situation. I know that a lot of sports leagues, including all the way up through the NHL and the NBA, are trying to figure out how they can salvage their seasons. I know that the NBA is thinking about how could they end up with some of the playoffs, but they might be playing in stadiums that literally have no people in them. I know that there is I think there was a baseball game in Korea that went on. Korea is not as much in love with baseball as Japan is, but they're holding baseball games in empty stadiums and playing for televised. And so I think, again, we've just got to be creative during this interim period, because we have to figure out a new way and a new approach. American Legion, I'm quite sure, is actually governed by the American Legion. Other high school sports are by the North Dakota High School Activities Association, and would direct questions to those folks. But I'm sure as Legion groups, and I say we should be looking in North Dakota to other states further south than us, because there's states further south than us that are either not playing baseball or have figured out a way to play baseball already, and we should be trying to adopt the models as outdoor sports come back on. I think we're seeing the PGA has announced that they've announced 4 tournaments that they're planning to do, starting I think the first one in early June. So professional golf may be the first sport that's back on. I've not been someone that's spent a lot of time, maybe 5 or 10 minutes of my life watching golf on TV, but it's for those that love doing that. I know some are fascinated by that idea. It'll be back on, but those are also going to be without crowds. So they're going to be holding golf tournaments without people there, but finding a way to, I'm sure, test all professional golfers, their caddies, and anybody that comes in contact with them. I'm sure is going to be a requirement as part of that reopening. So the whole sports thing, I think when you look forward to next fall, extending on this thing, I know that even the biggest universities, when Nick Saban, the coach at Alabama, has been talking to the chairman of Abbott, saying, how do we get how do we get football happening next fall? And we need answers by July 1, or we're not going to be able to have teams ready to play on the field next fall. So, and sports is it's another big segment of our economy. It's a big part of the national psyche. It's a big part of mental health. So, how to bring sports back online, whether it's local baseball or professional sports, is one of the big unanswered questions. But everybody's looking at it every day. The answer comes back for all the professional sports, and likely for us in North Dakota too, is our capacity for testing. It's one of the things that's going to allow us to do that.
So Jackie's alludes to the fact that the Williston Rec Department is looking for ways to fill the void with some kind of baseball, Babe Ruth or something. And can the Williston Rec Department feel that they have the governor's backing?
I wouldn't be making that determination on the fly from right here, because you'd have to see how they plan to do it, who's their actual governing body, and who's all involved. Jeremy, and then Jacob.
Governor, the Department of Health has a list of underlying conditions on its website that would make somebody more vulnerable to a serious illness from COVID-19. Those include lung disease, heart disease, severe obesity, diabetes, kidney disease, liver disease, and conditions that would compromise one's immune system. Has every single one of the 14 people who have died in this state had one of those conditions?
I don't know specifically the list you just read, but I believe that of each of the 14 names I've listed, they have had had at least one underlying condition, but I can double check that for you.
And is age considered an underlying condition? If somebody is in their 90s, that is not considered an underlying condition.
You can be healthy 90-year-old, and I hope all of us hope that we are, right?
mentioned the need to have more testing in order to have your May 1 reopening. However, a lot of at least the test counts that are done on a day-by-day basis do not come anywhere near the projected goals in the coming weeks and months. What happens to your May 1 plan if that demand for testing isn't met data-wise?
Well, I think one of the things that we have to try to do through, with your support to the media and others, is to make sure what the general said. I mean, if someone's symptomatic and wants a test, get tested. And I'd like to say again, I would like to never read a story again about somebody who said, I wanted to get tested, but I couldn't get tested. That may have been the case 2 weeks ago, 3 weeks ago, 4 weeks ago. It shouldn't be the case today. And again, if call the health hotline, call the governor's office, call whatever, call your provider, advocate for yourself, but get a test if you or someone in your family needs a test, because this is the way we're going to, really understand the scope and the scale of what we're up against, is if we get more testing. And we have successfully, through the work that the lab's done, working with suppliers and supply chain, working with the rapid response team, we have dramatically enhanced our testing capacity. And now it is, Jacob, as you say, it is demand. We got to make sure, particularly on weekends, people are, and this is typically the way it always has been, I don't feel that well, I'll wait till Monday before I get checked. I mean, so it's one of the reasons that we're going to be planning outbound targeted testing on Saturdays and Sundays going forward, because we know that we'll have additional capacity, because people generally don't go inbound and some clinics might be closed, so people aren't going and getting tested. But we really want to encourage people to get tested. I mean, other states actually have a campaign. I think Tennessee, who's ramped up their testing, has a when in doubt, get a test campaign. They're actually doing paid advertising to do it. We're not at that step yet, but we would like to see everybody that thinks they need a test or has a loved one that needs a test, please get tested. We've got the capacity.
Then obviously there's been a lot of success for the outbound testing. Any interest in expanding the asymptomatic test for the when in doubt approach?
Well, I think this is what the general talked about, is sometimes it's called surveillance testing and sometimes called sentinel testing. And this is a thing we want to do, and we want to continue to work on this. You'll hear more about this in the days ahead as we get even more capacity, but actually going out and doing testing proactively, because we have counties on the map that show up as they've got no actives. I don't think that's true. I think there's people with COVID in those counties that haven't gotten tested or haven't gotten uncovered. I mean, we learned that when we went to Slope County, that there was asymptomatic people that had COVID that could have been contagious during that stage. And so us getting a better sense of how widespread it is and where it is can help us increase compliance. It can help a number of things, because it's very easy to say, hey, there's no chart, there's no number on a chart for our county. Why can't we open the bar tomorrow? I mean, we hear that sort of all the time. And so testing will help everybody know that if we do open bars and restaurants, then they can understand that when they're going to a bar or restaurant, there is COVID in their community, and we still have the risk of outbreak. And we have just as much risk of outbreak at a bar or restaurant as we did at an LM plant. So it's like, those are things that people should know and understand. Andy, I'll come back after I go to Lane and then online. Lane?
Governor, with the May 1st deadline coming up, have you entertained the thought at all of a short-term stay-at-home order or a shutdown of sorts?
No. I mean, we stayed away from stay-at-home orders. We stayed away from shelter in place, and I don't see any need to do that with the testing capacity we've got here. We're on a path where we're trying to open up more as opposed to close down more.
With the Emmons County Record, will general tracing information be released to educate the public about where and how the virus is being spread? For instance, from family gatherings, parties, stores?
Yeah, I think that there's a blend here that we have to work on, because I think getting broader understanding of the virus and how this virus spreads would be useful for the general population to understand, so that people can make their own assessments about the amount of risk they're actually taking, whether it's for themselves, whether it's for family members, if they've got family members that are in long-term care facilities or have underlying health conditions and are at home. The more information is the better. We are working on some visualization tools, which I've just seen the first preview of, not ready for prime time, but a visualization tool that would show, if here's a positive, here's all the contacts they had, here's the number of those contacts that became positive, here's the people that those positives had contact with who also became positive, and it kind of builds out like a spider web. And I think we can talk all day long about contact tracing, but if you see one of those maps and you go, oh wow, certain people in my church became ill, and then that many more people became ill, and that many more people became ill. It helps people understand how this can spread, and again, that will be more useful when we've got more testing, because we drive testing up, drive our contact tracing up. But yeah, those are things that we would hope to continue as we build better systems to be able to share more data and educate people so everyone understands the risks they're taking. Okay, Andy?
We're hearing a lot of complaints that self-employed business owners who are ordered to shut down, like hair salons, are getting rejected for unemployment. Can you address if there's a problem?
Yeah, we hear this, and I would, and we've heard it about massage therapists as well, and I want to make sure that we just keep digging in alongside them. These plans were designed, the new programs were designed specifically to help those self-employed individuals, and so again, if you're having challenges, let us know. We also know that we've had reports of backlog on phone calls at job service. We had a meeting last night with leadership team. We're digging hard into that one because it's not acceptable for people to call, wait on a phone a long time, have call numbers get dropped. We know the team at job service is doing heroic work as we've described. Our run rate for all of 2019 was about 19,000 claims. We've done 3 years worth of claims in a little over a month. And so there's few organizations, I don't know of any organizations in the state that could do 36 months of, could scale up to do 36 months of volume in 1 month with the same staff. They've been trying to do that, but we obviously need to put more resources, enhance our call systems, do everything over there, because it's unacceptable that we've got these many 60,000 plus people that have filed for some form of unemployment that are also having challenges either getting answers or getting through to people. So I don't think it's acceptable, and the team is working to do that, and we're going to bring resources to bear to try to solve that problem. But I would encourage those individuals that are having challenges to keep reaching out, because we want to solve your problem, and if somehow the legislation doesn't cover you, then we want to get that information back to our congressional delegation so changes can be made in programs going forward to make sure they're included, because that was designed specifically to help those kinds of individuals. I'm going to go online and then to Jeremy.
April Baumgarten with the Forum of Fargo-Moorhead. Without the Smithfield numbers, South Dakota has about 1,200 cases, or roughly double North Dakota's. With both states having similar population and no stay-at-home orders, what is North Dakota doing differently that makes its coronavirus count so much lower than South Dakota? And are there any lessons you are learning from our neighbors to the south?
I would say that, again, both North Dakota and South Dakota, relative to the nation, have done very well. And we've stayed in regular communication with our neighboring states, and will continue to do that. And perhaps, it might be too early to take credit that somehow that there's been better decisions in one state or another. Part of it is luck. Part of it's geography. The geographies are pretty similar, but any state can end up having a breakout that can cause your numbers to pop. I mean, we had LM this last week, which took Grand Forks County from being one of our lowest per capita to one of our highest per capita, and so again, it's probably maybe too early to draw conclusions about that, but I would just say that we're fortunate with when we take a look at Wyoming, Montana, South Dakota, North Dakota. Those are 4 of the states that have done the best so far in this, and one of the things that we want to just keep pushing on here again is testing and contact tracing. That's the path forward. And I would say, again, relative to Minnesota, one of the things that we see there is we're fortunate, again, with our team, even though we're not doing as much testing as we want, we have been able to do quite a bit more testing per capita than Minnesota. We got, smaller population, but we've been able to get a lot of testing done. That's helped us make some really targeted decisions about isolation. I think that helps. Okay, Jeremy, and then Tom.
Will the state release more specific location information about positive cases, like zip codes, for instance?
This question has been asked frequently. The last time we took a look at this, I think was it either last Friday or earlier this week, we took a determination, decided not to do it because we have some cases where we'd already released gender, age, and county. And so then if you add zip code like Arthur 58006, and you said, hey, we got a male in the 30s that lives at 58006, I mean, we'd be basically just telling the whole world who's got COVID, and that would, I think, cross the threshold that we're willing to cross relative to releasing protected personal health information. So if we stopped saying, age and gender and just went with zip code, then we might be able to do it. But since we'd started down the path, I think there's an interest in, I think there's more interest in age and gender in terms of public safety than there is in zip code. And again, the point of knowing where cases are by zip code would be like, oh, it's here, but it's not here. And we know with more testing, it's everywhere. I mean, we know there was no cases in Slope County. We went there, we tested, it was in Slope County. So everybody in every zip code should assume that there's COVID in their community and act accordingly. So that's why I don't see that it would change any policy that we make, but it might release individuals' health information. Florida, for example, does do it, but Florida's got more people per zip code, and so they don't have the same risk. If we've talked about, would we release it by zip code for places like Fargo, like Cass County and Grand Forks, where we have enough cases where if you had 10 or more per zip code, would you start releasing it? We thought about that, but then that also would be a little lumpy because there'd be very few zip codes where we have 10 or more cases as like a minimum threshold before we'd release.
Follow-up to that then, since the question has last been asked, the state has added a list of known cases in nursing homes that includes the specific nursing home and the city where they're located. Is that not more identifiable information than the zip code?
I don't think so because, again, we're trying to protect individuals, and we thought that it was important for family members and for residents to know if there's COVID in a congregate facility, because these are the places where you've got high-risk individuals in a closed environment, and that's a very different situation than if you had somebody living on a farm in a zip code and they're positive and they're isolated at home. They're not going to get anybody else infected. But if you've got someone, a staff member or a resident in a facility, we think it's important for the public to know that. So that we think those two things are different. But again, you can tell we put a lot of thought into trying to release the right amount of information to help protect the public, but also protect individuals who may be stricken. I'm going to go Tom, and then online, and then Lane.
Question is about opening up. John Wooden said, be quick, but don't hurry. And yet you've got a president who has made it pretty clear that he wants his governors to make the decision, but he wants you to hurry. If things don't line up as we get close to the first, how difficult is it going to be for you to say, well, we're going to stop and wait another 2 weeks, and even if that is at the displeasure of President Trump?
Well, I think let me just start with John Wooden, and he's actually got the book, which I'm sure you've read, about be quick but don't hurry. I think it's a perfect analogy for right here, because what he meant was that in the sport of basketball, and of course he had that record-setting number of championships at UCLA, one of the winningest coaches of all time, he was really describing something where if you hurry, you can make mistakes. And this is a case where we want to be quick about reopening, but we don't want to hurry. We want to be ready. We want to be prepared. We want to do all those things right. I mean, Coach Wooden, one of the things that he taught his players, which drove them all crazy, when you're going to play on his team, he taught every single one of them how to tie their shoes. Because it was like, you're going to learn how to tie your shoes because you're not going to have, the final minute of the NCAA Final Four and your shoelace comes untied and you're hurrying instead of being quick and you trip and we lose a chance to win a game. So fundamentals down at the very basic level. So we're trying to build the fundamentals here in North Dakota around testing and contact tracing and do all that stuff. And whatever the White House guidelines, whatever other states are doing, all those things are inputs, but the decision making resides here in North Dakota, and we'll do what's best for the state of North Dakota. Online?
Radio Group, what methods are being used to notify specific communities about testing events?
General Dorman, you want to? Okay.
And it depends on the event. And it was mentioned earlier that, what are we doing as far as surveillance or sentinel testing? But when we went up to Spirit Lake yesterday, I don't know that there were any positives up there. So that'll be a great opportunity to see whether there's COVID within Spirit Lake. But as always, we work with our local partners. So whether it was Gladstone, Slope County, MHA, Spirit Lake, Grand Forks, we work with our community partners to set up the criteria. What do we need to test to protect people? And then, as always, if there's an opportunity for surveillance or sentinel testing to get some idea as to the rate of positives that are asymptomatic walking around, we try to do that because I think that does a couple things. It reinforces the message that to protect our most vulnerable, don't assume just because everyone's feeling fine that you're not potentially spreading the disease to the vulnerable population. And plus, it helps inform that decision down the road as far as where to apply our resources. So that's a long answer to say we work with our community partners to make sure we get the testing where we need to get it to best protect our citizens.
Last question, but as a follow-up to what the general just said, I want to, because I know that some of the interest about the outbound testing, the targeted testing that we're doing, is that people say, hey, I want to know about it so I can go get a test. If you want to get a test, call your provider and get tested. And that's available 7 days a week from all the providers in the state of North Dakota. So, there's always an opportunity to get tested everywhere in North Dakota all the time. The outbound stuff that we're doing is around identification, surveillance, by invitation when we're saying to people, hey, if you've had close contact with a known positive from last week, we're coming back. We're going to test hundreds of people that had close contact with those to help, do our more targeted isolation quarantine efforts to control the spread in a targeted way as opposed to try to control it with statewide physical distancing. So that's why, again, it's up to the locals to decide how much they want to release the information and when they want to release it. So we're managing that we get all the people that we want to get there. But anybody in the general public that wants a test, call your provider ahead of time, go get tested, and that's available all over the state right now. Go get tested right now. Go get tested yet tonight. If you got symptoms, go do it. Okay, Lane, last question.
Governor, I spoke to some guys who were looking for some clarification. One of these fellows was with some family over the Easter holiday. One of those family members ended up testing positive. He tested negative, but the group of guys he was with were told to quarantine for 14 days, while the guy that tested negative was told only 3 days. Should they all quarantine for 14 days, or is there some confusion there?
Well, I don't think there was confusion, but I think that the difference between he and the others was that he had a test and it was negative. If the others had been tested and were negative, then they would be released from quarantine as well. But in the early days, back, closer to Easter, another thing, in the absence of having testing capacity, the right choice was for people to quarantine. Again, quarantining is for people that don't have symptoms, but it would be just to quarantine for 14 days to see if the symptoms develop. But right now, one way to get out of quarantine faster is get tested, get a negative, and know that you can get, sort of get off the bench and back on the field again. Okay, we're mixing metaphors there. Back on the floor if we're sticking with basketball. Okay, I want to again grateful for all of our lab technicians. Happy Earth Day, and thanks again to the media for tuning in from around the state. Thanks for all the great questions. Thank you, General Dorman, for being here as our guest today, and we'll see you tomorrow at 3:30.